Hi, my name is Marwan Bukhari. I'm a rheumatologist and the current chair of the Research and Registries Committee at the British Society for Rheumatology. Welcome to this meeting. We're here to talk really about registries, and we've got 3 units that have shown some exceptional abilities to recruit to the registries. So we're going to start off with introductions to each of the units to see how long they've actually been recruiting into the registry, and then we'll explore a bit about good tips and things that basically might make recruiting into our registries much easier for all the units around. So we'll start with our team in Northumbria.
Hi, my name is Donna Gray. I am a rheumatology nurse specialist, have been in this post for 20 years now. I am a PI now for the registry, the RA registry. This is my colleague Sandra Rose, and she'll tell you how long we've been doing the registry for.
So we started recruiting for the RA registry back in May 2021. We were involved as part of the recruitment back in 2002. I wasn't in post at that time. I joined the registry post in 2021, January 2021. I joined the team.
So hi everyone, my name's Anna Ronan-Reid and I'm the Research Delivery Senior Team Lead Nurse for Aneurin Bevan in South Wales. So I've been working within the research team for about 9 years, and I started at our site as a bank research nurse about 9 years ago. That's how I started. And initially I was employed for rheumatology, and I found that the rheumatology registry, I found it in a filing cabinet. And what had happened was the consultant team had initially set it up, but as the number of follow-ups and the bit of a burden grew, that they became overwhelmed with it and they couldn't manage it anymore. So I started to pick that up, and now I'm the PI on the study. So that was in 2018 that officially I became the PI, and it's just been incredibly rewarding to do that. We also then opened up the PSA registry in late 2018. Again, I'm the PI on that, and it's been brilliant working closely with both study teams, especially PSA right from the start. I remember going to one of the first training in London to meet everybody. So it's just great to see how these registries have carried on growing over time.
Hi, I'm Danielle. I am a paediatric rheumatology research nurse working in Oxford, and I've been working in Oxford since 2016. And took on managing the registry from that point, although I think it's been open since about 2000, and I think our first recruits were in about 2011, and this is for the JIA registry. So yeah.
Okay, well, we'll start off really sort of like saying, can you give us a bit of insight regarding what did you find that you could do easily in the registry and what challenges you had? So we'll start off with Northumbria. So what did you find that you could do easily, and what do you think the challenges you faced?
So I think the thing that we do find easy now is we have recently set up a 3-monthly clinic, which is a face-to-face clinic, where we're seeing patients who've been started on biologic medication, and at that point we can obviously talk to them about the registry, ask they have been contacted prior to this to find out if they're interested. So seeing them in the face-to-face clinic is just much easier for consenting the patients and gathering the information that we need. And obviously we're getting it at the time, so we're not obviously the downside is when we're posting things out to patients, we were finding that we weren't getting a great deal of the actual paperwork back, whether that was going missing in the post or whether patients, weren't filling things in correctly and we were getting kind of incorrect information on things. So the setting up of this clinic has been really, really, good for the recruitment process for the registry.
Excellent. Any barriers at all?
We have a very big geographical area that we cover. So we're based at Wansbeck Hospital in Ashington, but we do have a hospital as far away as Berwick, which is about 54 miles away. And then we have Hexham Hospital as well. So we do have patients that are kind of widespread. So because we've only got the 3 monthly clinic in one particular site, it is hard to get patients to kind of travel to that one site. So we are still having to carry out some remote consenting as well for the registry.
Okay, well, remote consenting has always been a problem, and I come from Morecambe Bainer background, so I've got the same problem with geography. So great, thank you for that. Anna, can you tell us about your successes and your challenges in how you've been recruiting?
So within our site, the research team takes the lead in recruiting patients, but we are really fortunate that we have a really supportive infrastructure in place with the rheumatology department. So our clinical director, Dr. O'Leary Thomas, she's also the research lead. So we have strong backing from her and from the directorate manager. And we find that the research is basically embedded into the rheumatology team and the directorate meetings. So we have that in all the consultants are engaged, really supportive for including their patients within the registries. And what we find is that that allows us to recruit patients both in person and remotely. And the team will always support that. They often refer patients directly to us. But we're also looking at different ways of using, I suppose, technology. We just set our internet page, our health board internet page, which will help inform patients of the registry. So we're hoping that sometimes they may self-refer as well. And also on our local intranet page, there's all the information now for clinical staff, so they can see check eligibility and be able to signpost directly to us of any eligible patients. We have had some challenges. I wouldn't say, I think with the recruitment, we do have to consider the follow-up workload can be quite significant on top of that, and continuing that alongside recruitment. So ironically, our biggest challenge is when we are victim of our own success because of that burden. However, I have found that from both the RA and the PSA study office teams, they are really incredibly supportive and understand the pressures that we face. Also, I've come from paper now into the registry databases, which are brilliant. They're so well designed and intuitive, and I think when you work within research, you can really appreciate a really simple and straightforward database. So they make it really easy for us to track and prioritize which follow-ups need to be done next. I suppose the other thing, of course, is I accept as well what everyone else has been saying in terms of it's much easier to recruit in person. But of course, post-COVID, a lot of consultations that are happening are remotely now. So we've had to basically adapt to support that process. But it's brilliant that both registries allow postal and remote consent. We always prefer face-to-face, but sometimes that's not always possible. But there is the flexibility to do the remote consent.
That's great. Thank you very much for that. Danielle, can you tell us about your experience with the pediatrics?
So one of the big advantages we have is because I am a rheumatology research nurse, is that I'm embedded into the rheumatology team, and my only responsibility, is to recruit patients to various studies, including the registry study, and then manage all of the data. So it does make it a bit easier because it takes the pressure off the clinical staff, so they don't have to. They don't have to do very much for for the registry study at all, because I manage it all, which does help in terms of recruitment, because I know how much I can manage on follow up. Other people aren't recruiting it. Because I can completely manage how much the workload is. The biggest challenge, however, is obviously because these are all kids, they eventually move on to adult clinics, and unfortunately there isn't the support within adults to be able to continue the JIA registry once they transition into the adult clinics, because there's only one of me and I can't do all of it, and I can't carry on following them up once they're out of the clinics that I attend. So, but I do attend all of the pediatric clinics, so it means that whenever a patient is put on biologics, I know because I'm there and I can immediately give them the information at that point, and then plan to see them in 3 to 4 months' time when they come in for their follow-up.
So if I can summarize, so the three elements that seem to be coming out are about engagement of the clinical team within these registries. It's about the fact that there is an embedding of the research staff within the rheumatology units to cope with the registries. You've all mentioned that some of you have been PIs and some are not PIs. How important do you think any of that is to it? So let's start with Northumberland again. So if you're, is being a PI as important, or do you think the associate PI scheme is better, or not being a PI in the study but actually being embedded in the team is a good idea?
I haven't really thought about that, but I think because I've worked in research before and not been a PI, I think there's kind of benefits and to being a PI. I think that you kind of have a little bit more of a grasp on everything. You know who you've got working with you. You know that you can rely. Obviously, Sandy does a great deal of all the data entry and all the follow-ups as well. And I think being a PI, you kind of know who's going to kind of work better with you for the recruitment process. When you've worked in a team for a long time as well, we're kind of getting more staff on board. We are recruiting a pharmacy technician to kind of help with everything as well at the moment, which is going to, help greatly, especially with the time constraints of contacting patients via telephone. That person's going to actually be able to contact the patients before they actually start on the drug, to gain their interest, to see if they're happy to be on the registry, and that kind of saves us time doing that, doesn't it? Which will, hopefully we'll be able to recruit more patients that way. But yeah, I think being a PI overall is beneficial, definitely.
Any other insights about PI versus non-PI?
So within our site, I'm the PI and I think it's great to give other people the opportunity to have that experience. It doesn't always have to be a consultant rheumatologist, which we've had before, because the people working on the study will have that insight of how that we can provide the oversight generally over everything. In terms of API scheme, we use that a lot within our site for other studies, not so much with the registries. However, what I found with it does give a foot into research, into that PI role, and helps develop staff. It gives that support as a structured way to do it, and it ensures that people contribute to the study. And I say that because we often have some medical staff who will want to work within research, but what we find is that quickly fizzles out and they don't actually contribute or help, and it becomes more of a burden sometimes. But having somebody on an API scheme means that they I just find that when they're on an API scheme, they are more engaged. They really want to be recognised for that.
Danielle, do you have any insights as well?
So obviously, one of the consultant rheumatologists is PI at Oxford, and to be fair, most of what she does is sign bits of paper when I hand it to her. Like, I manage the studies, not her. So yeah, it's one of those things where actually, because they've got so many other clinical pressures, they can't focus all their time on managing a study. They just, it's just impossible because there are too many other pressures. Whereas obviously my job is research, so I don't have those pressures because it is my entire job.
Well, after this, you'll find some information about how to apply to be an associate PI or a PI through the National Institute for Health Research in a slide at the end of this presentation. Finally, do you have any more tips that you might want to tell? If a unit is struggling, what would be your sage words of advice to say, here's what you can do to actually start recruiting? I mean, if you find a unit that still finds the PSA register in the back end of a drawer and hasn't been able to recruit due to lack of follow-ups, for example, or a RA registry or a pediatrics one, what word of advice would you give them on how to do it? You want to start with Oxford this time?
So one of the things that I find that's quite useful is to sort of tag in to non-clinic appointments. So particularly for the patients being started on biologics, I'll have given them the information. I can often tag in when they're coming in for their TB spots, for their blood tests and things. Or I can even book them in with me to do the blood test and use that as the opportunity to talk about research. So it's using those sort of other sort of secondary appointments that aren't necessarily when they're coming into clinic. I find quite helpful for having the time and space when they're not being pulled in 6 directions by doctors and ultrasounds and nurse specialists and all the rest of it. And actually, they can book in flexibly with me for a blood test, and I can talk about it then when actually there is more time, and there's less pressure on them.
And how about you? Any tips?
So our success, I think, within our site is that we have that collaborative relationship, which I think we've talked about before, and the embedding is really important. I would say if there's a rheumatology unit or department that are struggling with the registries, please reach out to your research team, because what you'll find is they might be doing more complex commercial research studies, but what I found is that it serves as an excellent entry point, especially for new staff. For example, we've got a newly appointed research officer that's working within rheumatology at the moment, and the registries they're such a good learning experience. You're looking at patient records, you're helping to navigate pathways within the clinical team, you're understanding those processes, and you get to engage with patients. So beyond the importance of them, you're also providing really good training opportunities as well. So I think it's really important that you make research within part of your routine practice. The more integrated it is, the easier it is to sustain it. Engaging with all your wider teams, so that's not just your consultants but also your nurse specialists. And I love the appreciation we get from the registries as well. The study office teams are really good. Like I said, they provide really good training. Our rheumatology research nurses they're amazing at doing joint counts on all the tests that are needed, and we get even small tokens of appreciation from the study office as well. So even like the little beers and certificates, they're so important to make us feel valued as part of the research team as well. So they can thrive, but it's the collaboration that's really important.
Donna and team, any tips?
Yeah, I think again it's engaging the team that you have around you as well. We do have a monthly business meeting, and in one of the sections is research as well. So it's kind of bringing it up every time as well, saying we're actively recruiting for the study. If you have anybody that you think would be interested, or it's just keeping people mindful that it is ongoing and it's something that we're doing all of the time. We're quite lucky in that we do have a weekly therapeutics meeting as well, and that's attended by nurses, consultants, doctors, registrars, AHPs, and that's where they bring along patients who they feel need biologic medication. So that's kind of where we get most of our patients from. So that's a very useful thing as well.
So really being part of the clinical team and being embedded within there, and maybe providing extra bits providing extra care to the patients as part of the research might be one of the ways to do recruitment. Well, I think that's just very interesting, and anybody who wants to be more interested within the studies, please come and contact us at the BSR stand, and we can signpost you to anybody who might want to do it. And the last thing I would ask is, if anybody else to be mentored as a PI or a sub PI or as a researcher within there, would you be happy to be contacted by our membership?
Yeah, we're always happy.
I'm seeing nods.
Yeah. Yes.
Absolutely, there's everything to support recruitment into the studies. Well, hopefully you'll all be able to do that, and all of the links to the NIHR PI and the associate PI scheme and how to get onto it and train will be over at the end of this. Thank you all very much.